So there are a number. So patients with sometimes with atopic dermatitis, we know will just sometimes flare out of the blue. A lot of times we can relate it to something specific, a change in weather or something like that, stress. Sometimes those are obvious. But the most common situation that I see is there's no good reason why they flared that I can identify. And there are actually two different things that I think can happen there. One, it can be environmental proteins. So we know that aeroallergens, dust mite, pet dander, cockroach, these things are all proteases, and they activate the protease activated receptor on the keratinocytes and thereby drive inflammation. But much more commonly, the reason, in my opinion, that patients develop these unexpected sudden flares is a change in the strains of Staph aureus on their skin. So if they pick up a new strain of staph that is secreting a superantigen to which they are responsive, that change in their microbiome, which you wouldn't detect on a culture because they cultured staph before, they culture staph after. But whenever you do PCR testing on these strains of staph, what I have seen is that people will, at baseline, have staph that is not secreting enterotoxins. And then after they flare, they have a strain of staph that is secreting enterotoxins. So I believe that those flares are often driven by a change in the cutaneous microbiome.